If you're over 60 and dealing with sciatica pain that keeps coming back, even after doing stretches again and again, the real problem might not be your spinal disc. In some cases, the issue could actually be a lack of an important mineral that helps protect your nerves and connective tissues. My name is Dr. Micheal Kent, and in this video I'm going to talk about a connection between sciatica and a specific nutrient shortage that many doctors don't usually test for. What you'll learn in the next few minutes could help you understand why your pain keeps returning and what might finally help you get longer-lasting relief instead of short-term fixes. Before we continue, I'm slow. Where are you watching from and how old are you? Write your location and age in the comments below. It helps me understand who is watching and create videos that are more useful for you. Let's start with a simple explanation of what sciatica actually is. Sciatica happens when something irritates or presses on the sciatic nerve, which is the longest and largest nerve in the human body. This nerve starts in the lower part of your spine and travels down through your hips, buttocks, and all the way to your legs and feet. The sciatic nerve is formed by 5 nerve roots that come out of the lower spine. When one or more of these roots become irritated, inflamed, or compressed, the result is what we call sciatica. Many people try stretches to reduce the pain. And to be clear, stretching can definitely help, at least for a short time. The problem is that the relief often doesn't last. Later that same day or the next day, the pain comes back again. That's why today we're focusing on possible root causes, not just temporary solutions. In about 90% of sciatica cases, the issue involves the spinal disc. A disc sits between the bones of your spine and works like a cushion. It has a tough outer layer and a soft inner center that's a bit like jelly. When the outer layer becomes weak or damaged, some of that inner material can push outward. When this happens, it can press on nearby nerve roots, including the ones that form the sciatic nerve. That pressure can lead to symptoms such as pain in the lower back or buttocks, pain that travels down the back of the leg, discomfort reaching all the way to the foot, pain along the outer side of the leg. But sciatica doesn't always feel the same for everyone. Some people experience sharp pain, while others notice different sensations like numbness, burning feelings, tingling, a deep, irritating ache. Now here's where things become very interesting. While researching nerve problems, I came across a condition I hadn't studied in depth before. It's called myeloneuropathy. The word might sound complicated, but it's actually simple to understand when you break it down. Myelo refers to the spinal cord and the nerves that run through the spine. Neuropathy means damage or dysfunction in the nerves. So myeloneuropathy describes a condition where both the spinal nerves and the peripheral nerves are affected. This condition can cause many symptoms that are very similar to sciatica, including burning sensations, persistent nerve pain, numbness, muscle weakness, deep nerve irritation. What surprised me the most was the common cause behind many of these cases. A large number of people with myeloneuropathy are found to have low levels of copper in the body. In some situations, the problem can also be related to vitamin E or folate deficiency, but copper deficiency appears most often. This discovery made me start looking more closely at the relationship between copper and nerve health, especially the sciatic nerve, and what I found was fascinating. There are actually many products designed to help pain and inflammation that use copper. For example, copper bracelets, copper patches, copper creams, support braces woven with copper fibers. Some of these braces are designed to wrap around the upper hip area, right where the sciatic nerve begins. Many people report that these copper products help reduce discomfort and inflammation. Scientists still don't fully understand how copper might help when applied to the skin. One possibility is that very small amounts could be absorbed through the skin. Another theory is that copper, being a highly conductive metal, might interact with the body's natural electrical signals around irritated nerves. There isn't a huge amount of research yet, but that doesn't automatically mean these approaches don't work. A lot of people say they've experienced real relief after trying copper-based products, and these aren't just people looking for quick fixes. Many are actually quite skeptical at first. Because copper products are generally low-risk, non-toxic, and fairly affordable, some people choose to try them as an additional option alongside other treatments. Interestingly, the idea of using copper for pain relief is not new at all. Even in ancient Egypt, people wore copper bracelets and jewelry because they believed it helped with pain, swelling, and inflammation. And while modern science is still exploring the exact reasons behind these effects, the long history of use continues to make researchers slow about copper's potential role in nerve and joint health. Another condition often mentioned with joint pain is arthritis. Some organizations, including the Arthritis Foundation, say there isn't strong scientific proof that copper or magnetic bracelets help with arthritis pain. However, many people still report that they feel better when using them. But the bigger question is not about copper used on the skin. The more important issue might be copper levels inside the body. And this is where things get interesting when we talk about sciatica. Copper plays a role in many important enzymes in the body. Enzymes are substances that help different chemical reactions happen properly. One of the most important jobs copper helps with is the production of collagen and connective tissue. Why does that matter? Because the spinal discs, the cushions between the bones in your spine, are largely made of collagen. In fact, about 75% of the outer layer of a spinal disc is collagen. If the body doesn't have enough copper, collagen production can suffer. When collagen becomes weak, the disc can lose some of its strength and stability. This can make it easier for the disc to bulge or herniate, which may then press on nearby nerve roots and trigger sciatic nerve pain. Copper is also important for the nervous system itself. It helps support processes involved in nerve communication and the health of myelin, the protective coating that surrounds nerves. When myelin is healthy, nerve signals move smoothly. But when there are problems with this protective layer, nerves can become irritated or damaged, which may lead to symptoms like pain, tingling, or numbness. Some people with low copper levels also develop other nerve-related issues such as carpal tunnel syndrome. So copper plays two important roles here: supporting collagen and connective tissue, supporting the nervous system. You may have heard before that vitamin C is important for collagen production. That's true. But in nature, vitamin C often works together with trace minerals, including copper. They support many of the same processes. Copper is also involved in many other important functions in the body, such as supporting certain brain chemicals, including dopamine, helping with energy production, assisting with sleep regulation, helping create melanin, the pigment responsible for hair and skin color, supporting the formation of red blood cells, contributing to bone health, acting as part of the body's antioxidant defense system. Clearly, copper plays many different roles in maintaining overall health. So the next question is, how do people become low in copper? There are several possible reasons. One common reason is simply not getting enough copper from food. Copper is naturally found in foods like shellfish and organ meats, but many people rarely eat these foods. Another group that may have lower copper levels is athletes. Intense physical activity can increase the body's need for certain minerals. Exercise, especially at higher altitudes, can place extra demand on red blood cells and metabolic processes, which may increase the need for copper. If someone trains hard but doesn't maintain a balanced diet, they may eventually develop weaknesses in connective tissues, including tendons, ligaments, muscles, and possibly spinal discs. Certain nutrient imbalances can also affect copper levels. For example, very high zinc intake can interfere with copper absorption. Large amounts of iron supplements may also affect copper balance. Dietary patterns may play a role as well. Highly processed foods, excessive sugar intake, and large amounts of caffeine or alcohol can sometimes affect mineral balance in the body. Heavy sweating can also contribute to mineral loss, since small amounts of trace minerals leave the body through sweat. Some medical situations can affect copper levels too. For example, people who have undergone gastric bypass surgery sometimes develop deficiencies in trace minerals because absorption in the digestive system changes. There may also be genetic factors involved. Some individuals have small variations in their genes that affect how their bodies absorb or use certain nutrients. These genetic variations, sometimes called DNA polymorphisms, can influence how efficiently a person processes minerals like copper. This means that in some cases, a person could be eating a normal diet, but still have difficulty absorbing or using copper effectively. And when copper levels become too low over time, it may potentially affect several systems in the body, including connective tissue and nerve health, which could contribute to issues like persistent nerve discomfort. Sometimes the body can't properly use certain nutrients because of genetic variations. Researchers have found that a few specific genes can affect how well the body absorbs and processes copper. If these genes don't work efficiently, a person may end up with low copper levels, even if their diet seems normal. Some studies suggest that people with these genetic issues may have a higher chance of developing problems like carpal tunnel syndrome or even compression fractures. That's because copper also plays a role in bone strength, and bones contain collagen as part of their structure. So this raises an important question: what can you actually do about it? There are a few practical steps people sometimes consider. First option, external copper products. Some people try products such as copper braces that are designed to support the hip and upper thigh area where the sciatic nerve begins. These braces are made with copper fibers and wrap around the area to provide support. While results vary, some individuals say they feel temporary relief when using them. There are also copper patches and copper creams available. Many users report that these products help reduce discomfort, although research on exactly how they work is still limited. Second option, getting more copper through food. Certain foods naturally contain higher amounts of copper. Examples include liver, especially beef liver, oysters and other shellfish, dark chocolate with little or no added sugar, cashews, grass-fed beef. Adding a variety of nutrient-dense foods to your diet can help support overall mineral balance. Third option, copper supplements. Some people choose to take copper supplements to help correct a deficiency. However, supplements should always be used carefully, and preferably with guidance from a healthcare professional, because taking too much of any mineral can cause problems. For many adults, only small amounts of copper are needed each day, and a doctor can help determine whether testing or supplementation is appropriate. It's also important to remember that stretching and physical therapy still play an important role when dealing with sciatica. Stretching can help reduce pressure on the nerve and improve flexibility in the muscles around the hips and lower back. In other words, supporting your body with proper nutrition and maintaining healthy movement habits often work best together. This topic is especially important for people over the age of 60. As we get older, the body sometimes becomes less efficient at absorbing certain nutrients. Changes in digestion, medications, long-term stress, and years of dietary habits can all affect mineral levels. At the same time, age-related wear and tear in the spinal discs becomes more common. Because discs rely partly on collagen for strength, maintaining proper nutrition that supports connective tissue can become increasingly important. Think of a spinal disc like a tire that cushions movement. If the outer structure becomes weak, pressure inside the disc can push outward more easily. Supporting the body's natural repair systems may help maintain that structure over time. Nerve health matters too. When nerves are irritated or damaged, they can become more sensitive to pressure and send stronger pain signals. Nutrients involved in nerve function help maintain the protective layers around those nerves and support healthy signaling. That's why researchers are interested in the relationship between trace minerals, connective tissue, and nerve health. Instead of focusing only on temporary pain relief, the goal is to understand the underlying factors that may contribute to ongoing discomfort. Many people spend years trying different stretches, therapies, or treatments for sciatica. While those approaches can help manage symptoms, looking at nutrition, lifestyle, and overall nerve health may provide a more complete picture. Everyone's situation is different, but understanding how nutrients support the body can sometimes open the door to new ways of managing long-term nerve pain. In many cases, people who corrected their low copper levels started noticing major improvements. For some, their sciatic pain became much milder. For others, the pain eventually disappeared. This often happened over a period of several weeks or a few months. The reason could be that their spinal discs finally received the nutrients needed to repair and strengthen themselves. Before moving forward, there's one important point to remember. If you decide to take copper supplements, you also need to think about mineral balance. Copper works closely with other minerals in the body, especially zinc. These two need to stay in the right proportion. A good multivitamin or multi-mineral supplement can sometimes help maintain that balance. Another option is taking copper and zinc together in the proper ratio. For long-term maintenance, many experts suggest roughly 1 part copper to about 10 parts zinc. However, when someone is trying to correct a deficiency, the copper amount may temporarily be a little higher. It's also important to listen to your body while adjusting your intake. If copper is increased too quickly, some people may experience mild stomach discomfort. That's why it's usually better to raise the amount slowly instead of making a big jump all at once. If you notice anything unusual, reduce the amount and increase it more gradually. And if you have any health conditions or take medications, it's always wise to talk with a healthcare professional first, especially before taking higher doses of any supplement. Now let's talk about a simple action plan you can follow. Step 1. Think about whether you might be at risk for low copper levels. Do you regularly eat foods that naturally contain copper, like shellfish or organ meats? Are you taking large amounts of zinc, iron, or vitamin C supplements that could interfere with copper balance? Do any of the risk factors mentioned earlier apply to you? Step 2. Some people try using a copper brace or copper patch to help support the hip and upper thigh area where the sciatic nerve begins. These products may offer temporary comfort while you work on improving your overall nutrient levels. Step 3. Add more copper-rich foods to your daily meals whenever possible. Step 4. If appropriate, consider a copper supplement starting with a small amount and slowly increasing it over time. Step 5. Keep doing your sciatica stretches and mobility exercises. Stretching can help reduce pressure on the nerve and keep the muscles around the lower back and hips flexible. Step 6. Be patient. The body needs time to repair connective tissue and support nerve health. Collagen rebuilding and nerve recovery don't happen overnight. It may take several weeks or even a few months before you notice the full benefits. If you found this information helpful, consider liking the video and sharing it with someone who may be dealing with sciatic pain, especially adults over 60 who often experience this issue. And if you'd like to learn more about simple health strategies designed for older adults, feel free to subscribe for future videos covering nutrition, mobility, and healthy aging. Also, I'd love to hear from you. Have you ever tried copper for nerve pain or sciatica? Share your experience in the comments below. Until next time, stay active, stay informed, and remember that taking care of your health is one of the best investments you can make. Sometimes the solution to long-term pain isn't another exercise routine or another medication. Sometimes it's simply identifying a nutrient the body may be lacking. Important note, this video is intended for educational purposes only and should not replace professional medical advice. Always consult a qualified healthcare provider before starting any new supplement, especially at higher doses. If you experience severe or worsening sciatic pain, seek medical evaluation to rule out serious conditions.